Hello everyone, I'm Dr. Rachna Shanbag Moite, a pediatric immunologist and rheumatologist, and in today's video, let us discuss yet another interesting primary immunodeficiency disease. In the past videos, we have discussed about various phagocytic disorders which present with high neutrophil counts, for example, chronic granulomatous disease and leukocyte adhesion deficiency. So today we'll be discussing another phagocytic disorder, but this disorder presents with intermittent low neutrophil counts or neutropenia. Neutrophils, as we know, are the first line defense in our body. And whenever infections enter the body, the neutrophils increase in number to deal with these infections. So in children, when they have neutropenia, it's often concerning because not only are they prone to developing severe infections, but it also needs further evaluation for the cause of neutropenia. So how do we define neutropenia? In children less than 1 year of age, an absolute neutrophil count of less than 2000, and in children beyond 1 year of age, an absolute neutrophil count of less than 1500 defines neutropenia. So with this background, let us proceed to the case. Here we have an 8-year-old boy who has presented with recurrent oral ulcers. He often develops 2 to 3 oral ulcers every month and they last for a period about 3 to 5 days, after which he recovers on his own. He's also had intermittent episodes of ear discharge. And for these ongoing illness, he has had several CBCs performed over the past few months. When we tabulated these CBCs, we realized that in some CBCs, we could notice that this child was having low neutrophil counts. As you can see, the absolute neutrophil count on 2 occasions are less than 500. And in the other CBCs, the neutrophils go back to normal and they are showing normal neutrophil counts. What is also noticeable here is during episodes of neutropenia, we also see that this child has monocytosis. So with this background of infections and intermittent CBCs showing neutropenia, we ask this child to get serial CBCs done. And often in this setting, we ask the children to do CBCs twice per week for the next 6 weeks. And then the ANC counts were tabulated. And what we saw is that around the end of the second week and at the beginning of the third week, there would be a drop in the absolute neutrophil count. And this was seen on 2 occasions over a period of 6 weeks. And it is during these periods of low neutrophil counts that this child would develop infections in the form of otitis media and oral ulcers. This is a case of cyclic neutropenia, and the genetic defect in these children is mutation in the ELANE gene. So what is cyclic neutropenia? ELANE gene codes for a protein known as neutrophil elastase. And neutrophil elastase is produced by the early bone marrow precursor cells of neutrophils, such as in the promyelocyte stage. Neutrophil elastase is extremely important because it is involved in bacterial killing. So when there is a mutation in the gene, there is abnormal protein formation, and this abnormal protein folding leads to accelerated apoptosis of the neutrophils, leading to neutropenia. So these children tend to have oscillatory neutropenia, which occurs every 21 to 25 days and lasts for a period of 3 to 5 days. And during these 3 to 5 days where the neutrophil counts are low, they are prone to developing several bacterial infections in the form of otitis media, pneumonia, and even oral ulcers. So diagnosis in this case can be established by performing serial CBCs twice per week for a serial period of 6 weeks, and we can establish that this child has cyclic pattern of neutropenia. These children need to be supported with GCSF therapy with antimicrobial prophylaxis. So the message here is whenever we see children with recurrent infections presenting with neutropenia, we should often order a serial CBC. And if there is a cyclic pattern in the ANC, we must think of cyclic neutropenia. Thank you.